we need to surge, not just because we're worried that there'll be more Americans infected or that they'll get on a plane, but because this outbreak is already big. Over the last year, anti-American sentiment has surged because of the way that we pulled out our support overnight. We need to fully engage our CDC. We need to get back on the ground, make sure that U.S. support, financial, logistical, and medical support can help end this outbreak before it gets worse. Otherwise, it's going to be a problem, not just for the region, but for the rest of the world.
That's crazy.
Right? Crazy.
We can't do this again.
Nope. So, that's Dr. Craig Spencer, emergency medicine physician. He survived Ebola himself. He caught it treating patients in 2014. He now runs pandemic work at Brown University. And when a man who had the virus in his own body tells you we are already weeks behind, you listen, right? Because here's the part he said quietly that I need us to hear loudly. Over the last year, we've lost a lot of response capacity, particularly here in the United States. So it's not that we didn't lose it to this virus, right? We actually dismantled it on purpose. So I'm Dr. Haydée Brown.
And I'm Dr. Sonya Sloan.
And we are AYA,
Black and Brown Women Disruptors in Healthcare and Beyond.
So today we are talking about Ebola, but not the way that you think. We're not here to scare you that Ebola is coming for your family, because the honest answer is right now, the risk here is incredibly low.
Yeah. So again, let's start with the receipts. So on May 15th, the Democratic Republic of the Congo confirmed an Ebola outbreak in Ituri province. And it moved fast, you guys. As of last week, the health authorities are reporting somewhere between 500 and 600 suspected cases across the DRC and Uganda, with more than 130 suspected deaths. And that's moving fast. The exact count shifts by day, and who's reporting. And that's the fact that we're going to get to. Our numbers in the range, that's part of the story, right?
Yeah, I mean, this is the 17th Ebola outbreak in the Democratic Republic of Congo, DRC, and it came just 5 months after the last one ended, and it crossed a border. It confirmed death happened in Kampala, Uganda, a capital city. Cases reached Kinshasa, which is 1,500 kilometers away, and an American physician, Dr. Peter Stafford, contracted it, and he was evacuated to Germany. His wife, their 4 young children, also evacuated with him. And of course, they were separated and quarantined. So now here is the part that matters clinically. And this is where our training really kicks in.
Yeah, this is not the usual strain. This one is called Bundibugyo. That's the 2 Ebola vaccines we have right now, which is Merck's and Johnson & Johnson, were built for the Zaire strain. So people throw the word Ebola around without knowing what it actually does to the body. And so this is a viral hemorrhagic fever. And it starts something like the flu, the fever, the aches, the headaches, which is exactly what makes it very, very dangerous to catch it early. It then turns into vomiting and diarrhea, and then severe enough to collapse your circulation, dehydrate you. And then the virus attacks the lining of your blood vessels, and your blood losses. Eventually you can't a clot. And so that's what becomes so dangerous. You bleed to death internally, sometimes externally. And that's what you guys have seen probably on the pictures, the eyes bleeding, the gums bleeding underneath the skin. And it's scary.
And without modern critical care, IV fluids, electrolytes, blood pressure support, this kind of strain kills somewhere between 1/4 and half of the people that it infects. So let me just translate what I said. The medicine in that medicine cabinet that was built for this virus, it was actually built for a different lock. So we don't have an approved vaccine. We don't have an approved treatment. And that's for this strain. So the tools that we're proudest of, the ones that make Ebola outbreaks something that we just kind of, okay, yeah, but we know how to take care of it. That's not happening with this one. It does not fit this one.
And the World Health Organization, which remember the United States stepped away from, they didn't wait. The day after this was declared, they called it a public health emergency of international concern. So that's the highest level of alarm. This is it. So the speed tells you everything. The world's disease experts looked at this, that it's moved very fast and faster than it has done in years before.
So while the rest of the world is spinning, rushing, racing, where is the United States? We're not in the room. And that didn't happen by accident, right? Why don't we take a look at this clip about how it was decided? Roll the clip.
What is this one?
Withdrawing from the World Health Organization, sir?
Ooh, that's a big one. So we paid $500 million to World Health when I was here, and I terminated it. China with 1.4 billion people. We have 350. We have, nobody knows what we have because so many people came in illegally, but let's say we have 325. They had 1.4 billion. They were paying 39 million. We were paying 500 million. It seemed a little unfair to me. So that wasn't the reason, but I dropped out.
Ripped us off. And so because he thought it was a little unfair, we are now all at risk. That's the whole reasoning here. Not a health argument, not research, not the science argument, right? A grievance that he thought it was unfair of what China was paying.
And again, he thought it was unfair. He, an individual, not he really acting as the president, right? And just understand what that grievance cost us. On January 22nd of this year, 2026, the U.S. completed its withdrawal from the WHO. It takes an entire year. All funding terminated. All personnel recalled. And the U.S. was the World Health Organization's single largest funder. So roughly $700 million plus a year. And we didn't trim that, guys. We didn't scale back. We actually put it to zero.
And here's the line you should stop. It's going to stop you cold. This is from the epidemiologist who runs the pandemic center at Brown, Jennifer Nuzzo. When Ebola first suspected in the DRC, the CDC couldn't call the World Health Organization to ask what was going on, right? Because we had no skin in the game anymore.
Here's the sigh.
That sigh, that big one. This is huge. People
got to
read
that.
Yeah.
It's huge, right? Read that back. The agency whose entire job is to catch the fire early, that's the CDC, right? Was not allowed to pick up the phone and ask if there was smoke. This is not budget policy, right? That is a gag order on our own disease detectives.
And it's not just the phone line, right? It's the people. A quarter of the CDC staff, they're gone, you guys. There's nobody at the helm anymore, right? A JAMA, Journal of American Medical Association Health Forum analysis put it at roughly 3,000 employees. About 15% of the workforce departed since early last year. And that's not just a jump off the ship, right? These are laboratory scientists, epidemiologists, the exact people I need. When outbreaks start, we want them in the conversation at the table.
Right. They actually have a name, which is the Epidemic Intelligence Service, the quote unquote disease detectives. The disease detectives helped us with COVID, right? We knew something was coming. And so for the past year, those detectives have spent their time not knowing if they were fired or rehired. So you cannot chase an outbreak while you're updating your resume and unsure whether you have a job or not. So it's ridiculous, but we've named this playbook on the show before. It's the bury the evidence, the no data, no problem. The if you don't count the disease, you don't have to admit it's there.
Yeah, but Dr. Brown, it's what's different about this time, right? Now we've been through COVID, right? And everyone thinks, oh, we've been there, done that. This is not going to be a problem. But we don't have the support. And if you're also suppressing the information, that's a whole nother ballgame. You've taken off the dashboard offline, so no one knows what to look at or where to look, right? You can fire the person, the person that's counting these outbreaks and how it's going to affect the United States and what's coming into the United States. You cannot tell a virus to stop replicating. You can't tell a virus not to come across in an airplane that reaches the United States in Detroit, but is stopped somehow. So what do we do?
That's the whole thing right there, Dr. Sloan, right? We talked about this in one of our past shows, the measles dashboard going dark, right? That's a political problem. A hemorrhagic fever that has no vaccine crossing borders into capital cities while your early warning system is dismantled, that is a clinical problem that does not care who you voted for.
Exactly, not red or blue. And we're watching the proof of it in real time, unfortunately, in the United States. It's not just Ebola. Hantavirus has surfaced this spring. You have something that not normally is seen, right? And the specifics of the CDC center that would lead the hantavirus response, no response. What? Now it's run by a brand new acting director, because most of the center directorships are vacant or filled by people who just got there and don't know what the hell's going on or what to do. What?
The disease detectives we'd normally deploy for exactly that kind of event, those are the ones who spent this past year unsure if they had jobs or not. So this is what no data, no problem looks like when the disease is one that bleeds, right? Ebola is a hemorrhagic fever.
And it's a scary bleed. Like there's nothing to stop it, right? So let's really bring this home so everyone understands what's going on, because every AYA episode that Dr. Brown and I have come on, we always pose this one question. Who pays the first price when a system fails? Who's going to be greatly impacted, Dr. Brown?
So, it's the same people who always do. The poor, the Black and brown communities in the United States. And then when you think about this, when a global early warning system collapses, the first communities to feel it are never the ones with the private doctors and concierge medicine, right? It's the ones in the safety net hospitals, the county clinic, the rural provider, the communities who rely on public infrastructure because they were never given a private alternative.
Hell, they never had the money or the insurance to do so. And now our communities carry a memory about exactly that, right? We have lived what it means to government not to trust them when they decide what is better for you and who gets to live or die, right? Tuskegee, Henrietta Lacks. You guys are continually hearing about this, and go do your research before that's removed too. The grandmothers who learned that trust us without the data was how harm got done and how we end up dying.
So when they tell us the early warning system doesn't matter, that we pull out of the World Health Organization, that we gut the CDC, and that we will still be the world's leading authority, no. We are the daughters of people who learn the hard way. What happens next? Disease finds the gap, right? Disease always finds the gap. And the gap is widest exactly where this country has spent a century underinvesting.
And here we go. So 3 things right now. So number 1, know that the risk is here today, people. It's in the United States. Even if we don't identify it or it's going to be left unheard because they don't want you to know, don't let anyone on either side sell you a panic right now, right? Panic is not preparedness. Facts are preparedness. That's what we want you to know. Number 2, ask your representative one question on the record. Do you support restoring the CDC outbreak detection, staffing, and funding of the Epidemic Intelligence Service? That's a yes or no question. Make them answer it, because the next outbreak is not an if, it's definitely a when. And then thirdly, share this episode, because again, the story of what we want, Ebola, is far away and don't worry about it. It's not going to affect you. That's not the story we're telling you. We are unscrewed the smoke detector, right? No one knows, there's no batteries in it. But we did this on purpose. The United States, your government. So that's not the same story.
All right. They can pull us out of the WHO. They can fire the disease detectives. They can leave the labs empty and the directorships vacant, but they cannot negotiate with a virus, right? Ebola does not read press releases. It does not check the budget. It does not wait for a confirmed director. It moves, and it just looks for the gaps that we have left open.
And the next time it crosses an ocean, which it already has, and the next time is now, we will not be able to say nobody warned us, you guys. A doctor who survived Ebola warned us this week on the news that we just dismantled the part of the government whose job was to listen. So I'm Dr. Sonya Sloan. This is Dr. Haydée Brown. We want you guys to stay empowered, stay disruptive, and remember, your voice does matter. So we're AYA, contributors of MeidasTouch Network, and proud members of the Meidas Mighty. Please share, subscribe, like, and follow us for more updates. Have a great day.
Bye, everyone.
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.